And we're back. I'm Dr. Yassir Sonbol. Let's dive right back into today's medical conversation.
Hello, everybody, and welcome back to Real Medicine, Real Lives. You want to stay connected to this show and every Now Media TV favorite show, live or on demand, anytime you like. Download the free Now Media TV app on Roku or iOS, and unlock non-stop bilingual programming in English and in Spanish. On the move, catch the podcast version at www.nowmedia.tv. From business and news to lifestyle and culture and beyond. Now Media TV is streaming around the clock, ready whenever you are. All right, so I'm continuing my conversation with Ross Fan, the founder of Off Script Consults, and now I want to focus on something many people underestimate, the pharmacist as a patient advocate. Pharmacists are often one of the most accessible healthcare professionals in patients' lives. They see medication lists, dosing patterns, refill habits, drug interactions, patient concerns, and sometimes the questions people were too nervous or too rushed to ask elsewhere. So in this segment, we're going to look at how pharmacists help protect patients from preventable problems, how they support communication between patients and the healthcare system, and why patients should feel empowered to use their pharmacist as part of their care team. Ross, welcome back to the show. So, when you think about the pharmacist role, what do you wish more patients understood beyond simply picking up a prescription from you guys?
Yes, I'm glad you asked this question. I would like for them to not think of it as so transactional. I wish that they know that we can be a resource to them. So, for example, we can be an advocate and a liaison to help patients reach their health goals, whether that is increasing their understanding or saving money, coordinating with their other clinicians as well.
Gotcha. And so, what are the most common issues pharmacists can catch before they become serious problems for patients?
I think we hinted a little bit about it earlier, but of course, interactions, right? We can catch that before it becomes a serious problem. If we notice the new medication interacts with the medications that's already on the list, this is why I encourage patients to usually stick with one pharmacy, because then that means that their medication list is definitely accurate. Then we can contact the prescriber and let them know that, hey, kidney doctor prescribed this, heart doctor prescribed this, and, there's an interaction and ask for next steps or advice. Of course, we can also catch other things too, like missing medication. For example, after a patient gets discharged from the hospital with a heart attack, there's a list of medications that should be started. This is also the same thing with heart failure. And once in a while, a medication is missed on the discharge list. And then we can make sure that the medication gets added on and the patient doesn't have any gaps in therapy there. So those are a couple examples.
Gotcha. And so, how can patients use the pharmacy, or the pharmacist, I should say, more effectively as part of their healthcare team?
So I think it's more like a mindset change. So when they think of pharmacists as a less transactional, then and think of them more as an advocate or a liaison, then they can start using them more effectively.
Gotcha. And so let's kind of elaborate on that. So tell me, for example, when patients come to you to pick up medications, and you're running through the list of medicines that they're on, and how do you, I mean, I guess, how can pharmacists be more interactive with patients, physicians in general, in order to help better coordinate medications, things like that? And what role do you play in that?
Sure. So I think for me personally, I noticed that my role comes to something even as simple as saving money, right? Everyone loves to save money,
Mm-hmm.
and patients don't realize that that's something pharmacists can do. When I was managing an independent pharmacy, what I actually did was patient told me they were struggling to be able to get this medication. They had to decide between that and other things that they need day to day. And then I would tell them something like, did you know that the manufacturer might have a program for you? You'll have to fill out some forms. Here's a website. And then they go to it, they fill out the form. And then a week or two later, they told me, hey, I got approved. Thank you so much for letting me know about that. I didn't even know that existed. So, for example, just something like that. Other things that I believe that we've been able to help patients out with is as long as they tell us what goals they want, health goals wise, we will try to help them. For example, I gave an example earlier about a patient wanting to take less medications. That was their goal, and I found a way to help them reach that goal. Other patients, they would like to take more natural medications, and I help them make sure that they are doing that safely with their current medical conditions and their prescription medications.
I'm glad you brought up the cost of, saving on prescriptions and so forth. As a healthcare provider, I mean, I get a lot of people that come into my office, obviously promoting, medications and asking us to prescribe things and so forth. And, my general rule is if it's what fits with my guidelines or my practice, that's what I do. And if it's not, it's not. Um, I get a lot of conversations with people that are like, oh yeah, this medication is really well covered. I mean, obviously take Medicare out of the mix because that's a whole different ball game. But in general, when we're talking about commercial insurances, et cetera, and surprisingly enough, the patients will come back and say, this medication was really expensive. And so can you tell us the difference between, because I think patients really should understand this, the difference between what insurance decides to cover versus I'm assuming pharmacies has a role in how they set prices for the prescriptions that they sell, et cetera. So I think so patients understand the dynamics of how all that works. Because I have patients that will, come and say to me, for example, Brilinta is a drug that always I get told, it's really well covered by insurance. It's $18 a month by commercial insurance, et cetera, which I don't really know the truth or not. And then I'll have patients come back and say, well, this drug costs me $300 a month, and so I don't really know how to explain that to people. Maybe you can elaborate on that more.
Yeah, sure. I think that's a great question. That's definitely another way that I think pharmacists are able to save money as well. Not all not all pharmacies do this though, but let me start with the beginning of your question. I think you asked how the whole pricing thing works. So pharmacies work with different wholesalers. Most of them tend to work with only one. This is where I think for independent pharmacies, a little hint, I would say don't be loyal to just one wholesaler.
Hmm.
Actually use more than one, so then it helps with negotiating prices. Of course, if you also join some type of co-op as well, that helps with negotiation of prices to get the wholesaler to decrease how much it actually costs the independent pharmacy to buy the medications. But then after that, it's also insurance comes into play as well too. Insurance sets certain prices. So, like you mentioned, someone that claims overall that this Brilinta medication costs $18 across the board. Not true. It really depends on everyone's insurance, and every insurance company, also have different plans, right? Which makes things more complicated. So when what my team did was in the past, what we would do is we would run the prescription through, let the patient know the cost. And if it does look like it's going to be pretty expensive, we actually ask them if they're okay with us contacting the prescriber for them. And we would run the prescription, run another, like clopidogrel, for example, through and see if it's less expensive, if it's preferred by the insurance company. If we notice that the price is different and the patient is okay with this potential change, we contact the prescriber and ask if they would consider this to help the patient stay adherent due to cost problems or cost issues or concerns. And that's actually how we usually do it to help patients save money, but also can start and stay on their treatment.
You must know I'm a cardiologist. I'm glad you brought up clopidogrel because that's a drug I prescribe on a regular basis. And I always assumed clopidogrel is generic, right? And so at this point, because when I was first started, working, clopidogrel was not generic, and it was the only antiplatelet therapy we had on the market. And it was $200 to $300 a month for people to take it, and they couldn't wait to get off of it, right? Because it was expensive. And so, can you give us an idea of is there a standard in pharmacies for what generic medicines cost? Or is that also a price that differs from pharmacy to pharmacy? Because I've had people come and say, well, my clopidogrel is like $40 a month, which is surprising to me because I'm like, well, it's a generic medicine, and I always thought generic medicines are like $5 a month, but I don't really know. So can you maybe explain to people how generic medicines are priced as well?
Sure. So, generic medicines, unfortunately, is also priced differently from pharmacy to pharmacy as well. And partly it's because, again, insurance comes into play, right? Where the insurance would have a network of pharmacies that they prefer or don't prefer. And so let's say that clopidogrel at one pharmacy actually could be, like you said, less expensive. It could be $5, but then the patient prefers to go to this other pharmacy, and unfortunately, that pharmacy is considered out of network, right? And that increases the price. I think you've noticed almost everything has tiers when it comes to insurance, and if you're on the appropriate tier, you can save money. If you're on the non-preferred tiers, it can be more expensive.
Gotcha. All right. Well, so what's become clear is that pharmacists are not just connected to medication. They're connected to safety, access, communication, and trust. And for many patients, that guidance can make the difference between feeling overwhelmed and feeling supported. So we're going to take a little short break, and when we come back, we're going to look at the digital health information online, medical content, and how patients can protect themselves from confusion and misinformation. So hang out, we'll be right back in a couple minutes.
Stick with us. We'll be right back with more real stories, real breakthroughs, and real lives transformed.